Hi guys, today we will be discussing about another IV agent, that is dexmedetomidine. It is non-selective, reversible, central alpha-2 adrenergic receptor agonist. Can you tell me another alpha-2 adrenergic agonist receptor? Yes, that is clonidine. But dexmed has alpha-2 affinity much more than clonidine. Alpha-1 is to alpha-2 ratio of dexmed is 1600, whereas for clonidine it is 1 is to 220. So coming to dexmed, back to dexmed, it is non-selective reversible alpha-2 agonist. What does this receptor do? Alpha-2 agonist, as you can see in this diagram, it causes feedback inhibition of norepinephrine release. So it prevents the release of norepinephrine, and we know what norepinephrine does. It increases the heart rate, increases the BP, and dexmed causes inhibition of all this. So it causes hypotension, it causes bradycardia, it has analgesic and sedative effect also, and it also causes inhibition of release of adrenal catecholamines. Again, decrease in the blood pressure and heart rate. Coming to its effect, it is sedative, anxiolytic, hypnotic, analgesic, and sympatholytic effects. Coming to its structure, it is S enantiomer of medetomidine, and it is a imidazole derivative. Can you tell me another IV induction agent which is imidazole derivative in the comment section below? Coming to its availability, it is available in 100 microgram per ml of 0.5, 1 and 2 ml of vials. And coming to its pharmacokinetics, it is metabolized by liver by glucuronidation and cytochrome P450 using hydroxylation and methylation processes. It is highly protein bound with T half of 2 to 3 hours and context sensitive half life of 4 minutes and 250 minutes after 10 minutes and 8 hours of infusion. Coming to its effect on central nervous system, as we already know, it has sedative effect and analgesic effect. Coming to sedation, how it causes sedation by decreasing the activity of projections of locus coeruleus, and very important is it causes natural sleep patterns as opposed to other GABAergic agents like midazolam, like thiopentone, like propofol. Yes, so it has a natural sleep pattern. That's why it can be used in ICU for sedation, because it is easy to wake up the patient and patient might follow commands, and therefore it has been approved by FDA for ICU sedation. Coming to its analgesic effect, because it has analgesic effect, we will need less of the opioids, decrease narcotic requirement, therefore it can be used in opioid free anesthesia, and it can be used as an adjuvant in caudal and in other blocks. It decreases the cerebral blood flow rate, but there is no change or minimum change in the cortical evoked potentials. Therefore, it can be used during neuro monitoring. And also, very important, the carbon dioxide responsiveness and autoregulation is preserved with dexmedetomidine. Very important. Coming to its effect on respiratory system, although it decreases the minute ventilation, but there is not profound respiratory depression, and there is no change in the arterial oxygenation or pH or carbon dioxide ventilatory response curve. Very important, since it shows normal sleep pattern, there is hypercarbic arousal phenomena seen. That is, if there is apnea, there is increase in the CO2. Increase in the CO2 causes arousal, just as seen during OSA. So it follows hypercarbic arousal phenomena. So it is beneficial as it can be used in opioid free anesthesia. It can be used in hypotensive anesthesia, in which we need decreased blood pressure to decrease the blood loss, and it can be used for fiber optic intubation also. Coming to its effect on cardiovascular system, it has biphasic blood pressure response depending on the dose. In low dose infusions, it decreases the mean arterial pressure, and in high dose, it increases the blood pressure. And also, very important, it causes transient increase in the blood pressure by its vasoconstrictive effect on peripheral alpha 2 receptors. Other effects, very important, is hypotension, bradycardia. It causes bradycardia. Coming to its uses, it can be used in conscious sedation, as we have already discussed, for ICU sedation, for diagnostic purposes, for various diagnostic purposes, for MRI, for awake fiber optic intubation, it can be used, and it prevents the drug withdrawal symptoms. And where should be used cautiously? In patients with heart block. Why so? Because it causes decrease in the heart rate. Very important. And also in volume depleted patients. Why so? Because already there is hypotension, and it further causes aggression of that. Along with vasoconstrictors, you should use it cautiously, and in patients who have already bradycardia, you should use it cautiously. And we have dexmed antidote, that is atipamezole, which is specific and selective alpha 2 receptor antagonist. Very important part of Dexmed. Another important part is it reduces post-op shivering. So it has been used to decrease the post-op shivering along with other agents. Coming to dose, it can be used in total IV anesthesia. It can be used in IV regional anesthesia, can be added to lignocaine. It can be used in post-op sedation with 0.2 to 0.7 microgram per kg per hour, and it can be used in general anesthesia with loading dose of 0.5 to 1 microgram per kg per hour over 10 to 20 minutes, followed by 0.2 to 0.7 microgram per kg per hour. And it can be used as an adjuvant in the blocks. Thank you. I hope you like my video.